Welcome to the HFL 270 Module 2, the Endoscopy Project. This module and this project will be the most intense work of your HFL experience. It is Capstone 2. This is what we've been building up to for many of our courses and in this program. So HFL 270 Module 2 Endoscopy Project, it's interesting. We had studied in the past, we've done different little projects, we did some lab drawings and code referencing, we've done some patient room stuff and things like that, and I really was having a lot of considerations on what project to do, what to wrap up here, and then really I think a lot of things came together, including a few conversations with some of my peers, and that is that, a lot of the industry, as you all know, is moving towards outpatient. We've covered that over and over again. And in the outpatient environment, and in the inpatient environment as well, there is a lot of rooms that need to be set up for endoscopy areas. And these rooms have a certain level of complexity that's unique to the space. I considered surgery suites, and I considered ICU. I even considered maybe even like a cath lab or procedure room, and even isolation rooms. But the endoscopy project will bring really a kind of interesting awareness to you as we go through the project. Endoscopies are one of those rooms where it seems simple enough, and to a certain degree, when you understand what's needed, they are simple enough. However, there are very specific issues with endoscopy when it comes to pressurizations and when it comes to layouts and configurations that make them pretty special. And they're also the kind of project that it could possibly fall into the hands of a moderately trained in-house staff to do this space. Now, I would suggest that most of these should be done by an engineering group, an architectural group, maybe architectural, but engineering for sure. And in the folks that you have and the trades that you have, make sure that you have all the trade sets for this job, because as you're going to find out, it does bring a lot of different components of healthcare and codes and regs and compliance and standards and equipment into a space. And I think it's just the right size is what it comes down to. And a lot of these projects are going to be done not just in the hospital, but again, as you mentioned earlier, in outpatient spaces. There is a perception out there, as there always is by those who are untrained and uneducated and unfamiliar with our jobs and what we do, that a room like this is just pretty simple to put together. It's not considered a complex space, but it is a very complex space. So we're going to be doing, on this project, endoscopy project, and another interesting thing in the news. There was a article in the USA Today just recently about infections. Some of you probably received that from me. And actually, I think that's not the one. This one I was thinking of was actually just on the internet, and talking about duodenoscopes and how the infection rates, how they're starting to find out that there's a lot more infections and undocumented infections. Well, duodenoscopes are specifically tied to endo suites. And there's also some other variations with this project that I'm going to throw at you. We're going to have some project meetings. We'll talk about that in a moment. But I think that there are some real changes that I know of, having done a couple of these, that can be thrown at you midstream in a project. They can make you really scratch your head. And so, we have lots of opportunities to learn here. Again, this is a 7-week module. I think I mentioned somewhere earlier, maybe an 8-week module, depending upon how the semester is going and how we're doing. But it is a 7-week module, and I have it wrapping up November the 8th, which gives me an entire month to grade these submissions. This is basically a portfolio submission. So all the documents are going to be submitted in one great big lump, in one great big portfolio in a specific order, and we'll cover that in a moment as well. But welcome to HFL 270 and Module 2. I think this is going to be a tremendous exercise. I really look forward to your feedback at the end of the course, at the end of the module, and throughout the course and throughout the module. And again, this is pretty exciting, and I'm pretty happy to settle in on the endoscopy project for this module. Project layers. Okay, so here's the layers we're going to have as it relates to this assignment. There's going to be a project overview that needs to be written. You know, what is the project about? We're going to do a Gantt chart, put together a timeline. Understand when we do Gantt charts, actually we'll talk about that in a moment as well, but I'll mention this twice, I guess. But Gantt charts, you know, really, if the project is going to last 7 or 8 weeks of construction, you probably have twice that in planning. So, you know, while you will throw this Gantt chart together pretty quickly, know that when it comes to planning and mobilization of equipment and orders and capitals and POs and contractors and all those kind of things, it probably will take legitimately somewhere between right around 16 weeks or 3 to 4 months, if you will, even maybe longer, depending, to actually start a project. And we're going to do it much quicker because we're doing it more in theory. ICRA, of course, we'll have to do that in ILSM. Again, I make a comment, pretend that it's inside an inpatient occupancy. We'll talk about that again. Drawings, graph paper, you've probably already seen in this module. I gave you a website. You don't have to use it. You can use any kind of graph paper you like. I just don't want, you know, I want you all to be 100% aware that you need to use graph paper and standardize that for drawings. A punch list, certificate of occupancy, room and equipment list with maintenance schedules, and meeting minutes. So that's the layers we're going to have, and now we're going to go over those a little bit more detail here one by one. Also code references, yeah. You know, I put on the syllabus and you know, some of the documents we're going to use: FGI guidelines, NFPA 99, NFPA 101. Those are going to be the core documents. There are a few other documents you might want to go into if you like, related to some of the projects, but these should cover the majority of what you're going to need for the project. I made a comment here, no sprinkler plan, primarily because when it comes to sprinkler systems, rarely is that done in-house. Almost always you're going to engage a sprinkler company who's going to get the documents done and the drawings done and everything else. So I didn't put a sprinkler plan, even though it's obvious that we will also have to have a sprinkler plan as it relates to construction projects. Minutes and meetings. Okay, well, we're going to have 4 meetings, and we're going to have 4 collaborate sessions. And I make the comment down below that you need to attend 3 of the 4 meetings to obtain credit. You know, as I'm putting together the rubric for this, I'm trying to figure out how to weight these things. You know, it's going to be substantial. However, I know that this is going to be tough. However, it is a capstone course. You know, I know you're committed to this, and this is very important. But I really would like you to attend all 4 if possible, but 3 out of 4 will get you credit for the meeting minutes. And the expectation, of course, is that we're going to take, you're going to all take your own minutes. You're going to take, you have to be taking minutes during the meeting, even while you're talking and when others are talking. And that's the challenge that we run into when you are doing meetings and you don't have a secretary and you're not fortunate to have someone there to take minutes for you. So we're going to practice taking minutes. In fact, I'm not going to, at this point, I'm not going to do a whole lot as far as formatting for minutes. We could spend probably a week module or 2 weeks module just doing that. However, you know, I will trust that with all the writing we've done throughout these courses, that you guys will come up with a format that will be effective. Again, we have the 4 dates. They're all Friday nights. The one date that I might change because it is my wife's birthday, and that is October 23rd. But so I didn't necessarily put that there. But they're all going to be Friday night meetings. Typically, they're going to be 9 p.m. Eastern time because we'll have folks from across the country. And, you know, we've done it before. So we're going to set up 4 collaborate sessions that we recorded for those who cannot attend. And I suppose I will allow you to review and type up the minutes. However, again, that may be okay for 1 meeting because really your attendance is needed at these meetings. So I hope that makes sense to you. I think that it will definitely help give you a flavor of minutes and meetings, and it'll be an important part of the whole project. Project overview, again, here it is. You have been asked to take a 750 square foot or 30 by 25 shelled space at the OCTC Outpatient Center and create 2 endoscopy procedure rooms with an attached supply/scope room. And, this is important, a shared sterilization room. Each procedure room is to be equipped with the following. You're going to have a main video cart. And on that video cart, you're going to have different pieces of equipment that come with a video cart, like a light source, like a camera, like a printer, like a monitor, and things like that. You're going to have attending staff video monitor, an anesthesia machine, notes, dictation desk, scope cabinet, and transport procedure bed, and something else I didn't put here, but I think I may have included it later, and that is, actually maybe continue on the next page, and that is a defibrillator, which is on the previous page. Also, the sterilization room shall include required elements per FGI guidelines. It'll have one hydrogen peroxide sterilizer, shared by the rooms, and then the clean supply room will include a ventilated closet for extra or clean scopes. So that's the scope of the project. We can get more questions asked during our first meeting. And if I come up with a few more details between now and when this session starts, I'll add those as well. The Gantt chart, you have 6 weeks for construction and 1 week for turnover to center staff. So that's your schedule. You have 7 weeks. So you're going to have to write a Gantt chart that actually covers the 7 weeks. I am not going to give you that much more detail. You're just going to have to think through the different phases that it will occur in the project and try to give them some timelines and some dates and some schedules. And keep in mind what contractors can be in there at the same time. The good news is that idealistically, in this case, you're going to assume that you're going to be able to schedule those contractors for those dates, and they're not going to call in for the various reasons or have conflicts or be called off to other calls and things like that. So you're going to have a fairly ideal schedule. So that may help. I do want you to give some real thought as to how long it may realistically take to do some of these jobs. This is not a TV show where we're going to build a house in a week. Even though you can mobilize lots of resources morning, noon, and night, there are challenges with getting contractors mobilized. And in this case, being that it's an outpatient facility, not a hospital, trust me, at hospitals, scheduling construction work, sometimes you have to work around, operating room schedules or procedure schedules or working hours and do things after hours. But in this case, it's going to be more of a pure job where you have essentially that shelled space all to yourself, and you're going to have very few, shutdowns per se. In fact, that's one thing I did forget to put in here, and that's a shutdown request form, and I'll be sure to add that to this as well. But anyway, on the Gantt chart, you're gonna have a pretty, pretty clean schedule. ICRA, we've already talked about this to some length. I've supplied a writable form. Again, keeping in mind it's an outpatient environment, but we are going to assume the outpatient cancer treatment is part of the building, so that will drive your infection awareness even higher. And we'll make the cancer treatment department next door inside the building. ILSM, assume a phase where sprinkler system and fire system will be disrupted. Keep in mind that contractors frequently cover smoke heads to minimize false alarms. That's something else to keep in mind. You're going to want to find, review, and find a daily checklist. That's a requirement that the space is checked daily. And then you want to assume that there's going to be some hot work as it relates to med gas for this project. Drawings. These are going to be, there's some of the outlines of the drawings here. Again, we talk about the documents we're going to use. I put ASHRAE 170, which is built into the FGI guidelines, but you can find that as a separate reference if you like. A graph paper which you have, and again, separate layers. Each one of these layers will have its own drawing. And the drawings in this order will be floor plan, the HVAC, again, which really more specifically the diffusers. I'm not looking for above the ceiling. I'm not looking for the VAVs. I'm not looking for ductwork per se and sizing. I'm looking for a specific diffuser's location and some thinking as to why you put your diffusers where you put them. 3, electrical and lighting. So this is basically your outlets, and this is also going to be some of your low voltage stuff as it relates to phones and nurse call and also your communications and things like that, and lighting. 4, plumbing, self-explanatory. 5, medical gas, self-explanatory. 6, life safety drawing. In this space, I think I make a comment during the space. We'll talk about that in a minute about what that's about. 7, finishes, and 8, equipment. Now I'm going to go through each of these. The floor plan, you can have 2 procedure rooms that share a common sterilization area and supply room. Code required dimensions and cite code references on the drawing. When you do the citing of the code references, make sure again you have a nice, almost like legend on one part of the drawing, left, right, some part of the drawing where you cite and you notate the references inside of your drawing, and then you have the citing and the reference off to the side. HVAC diffusers, again, placement diffusers with a rated CFM for space, cite code references on drawing, do not have to show above ceiling work, we mentioned that already, and caution on shared sterilization diffuser location, and that's all I'm going to say about that. Electrical low voltage 2, again, we talked about this a minute ago already, outlets, video outlets, again, two-handed sided room, again, lots of times what you have with some doctors is that they like to be on one side or the other side of the room, based on the position of the bed or their left or right-handedness. So you have to have video outputs on both sides of the room to accommodate that. Phone, which is going to include voice over IP, computer, nurse call, and be sure to cite code references. Plumbing, sinks and drains. Okay, that should be about it. Medical gas. Again, while most procedures are local anesthesia, it is not uncommon to have full anesthesia capabilities in these spaces. Plan accordingly. Again, be sure to include references. Equipment. Anesthesia cart. Okay, physiological monitor with the following modules: BP or blood pressure, SpO2, saturated oxygen is what that is, and then ECG, electrocardiograph. You can have a blood gas monitor. You have a video equipment with the following modules: camera, printer, monitor, lamp supply, computer. A second monitor, that's for so that the physician will be looking at one monitor, support staff will be looking at the other monitor on the opposite side of the cart or the bed. Defibrillators, just one, shared by the spaces. A procedure bed and procedure light above bed and backup suction machine. Now mind you, this will be 2 rooms, so some of the stuff will be doubled. My objective for you is to find these types of equipment, source them on the web, and then want you to find and put makes and models. You don't necessarily have to do serial numbers, but you can make that up and create essentially an inventory. And while you're doing that, you're also going to research what type of schedule these things would need to be on as it relates to code. Okay? I hope that makes sense to you. And again, that comes back to understanding risk levels and life safety levels when it comes to equipment. Finishes. Okay. Want you to cite floor finishes, ceiling, casework, walls. Again, think infection control, durability, and staff behavior. And I make a comment here, corner guards. And hopefully you know what corner guards are. But again, the main thing about these endoscopy suites is they're fairly tight spaces. There's lots of equipment. There's lots of movement. And therefore, there's often lots of damage. And the walls get hit and soiled and dirty. So think about that as you're constructing, and think about the kind of material and the finishes you would use to help maintain the space at a very high level, not just cosmetically, but also for infection control. Life safety. Okay, the walls entering the space in the corridor is part of the smoke compartment, not partition. Very important. Currently, there is only one door entering the 750 square foot space, so you're going to have to make some wall modifications. And the sprinkler work and drawings is contracted out and will be completed by others. Do include in phasing. Now, going back to the smoke wall compartment, the wall, the corridor wall, we're going to make that corridor wall where the doors are going into the space, or where you're going to have to logically put the doors from the hallway. That is going to be the smoke wall, not a compartment. Now, that's pretty uncommon. In many cases, that is maybe a partition, or maybe not rated at all, depending upon the age and the build and the sprinkling of the facility. But in this case, we're dealing with a fully sprinkled facility, and the whole wall is going to be part of the smoke compartment. So again, there is a definite life safety concern and issue as it relates to the wall on this project. Okay, this is the last slide, and I just want to make sure that you all, I know you know this, but please don't delay. This is a lot of hours spread out over 7 weeks. Be sure to have questions ready at the collaborative session, prior to the collaborative session. Although I may not have the answers for you, I'll do research and get questions. I'm assuming a lot of you have similar questions. Enjoy. Again, I think that you should get the sense that you have learned enough to pull this together, and that is quite an accomplishment. And again, another reminder, the due date is November the 8th, 2015 of this module. I will only extend if I see that there is an issue as a result, with the majority of the class, or we'll figure that out as we go through the project meetings, whether or not there needs to be an extension or not. But at this point in time, the due date is the 8th. But since, again, you are the first, we'll have those meetings and we'll have discussions and we'll see how things go from there. Like any other project, we have to make sure that, we have good open communication, and my goal is to set you up to succeed, of course, and not to fail. So that's it. Again, I hope you enjoy, and thank you for your time, and good luck to you on your endoscopy project.